Jordan Alexander, health assessment, cardiac examination. Hello, my name is Jordan Alexander. I'm going to be doing a assessment of your heart and your peripheral vascular system.
Okay? Sounds good.
Okay. So the first thing I'm going to have you do is lean back under this pillow. Okay. So the first thing I'll do is I'm going to look at your jugular veins and your carotids. So I'm going to have you look to the left. So I'm looking at jugular venous pressure, looking at carotids for pulsation. Have you look to your right. Right. And then I'm looking at the point of maximal impulse for pulsation. All right. Now the next thing I'm going to do is I'm going to palpate. I'm going to feel your carotids, feel the pulses. All right. Feel +2 pulses, no thrills. +2 pulses, no thrills. And then I'm feeling the point maximal impulse, midclavicular line, 5th intercostal space. All right, pulse noted. All right, now I'm going to listen to your heart sounds, okay? First I'm going to listen to your carotid arteries, listen for bruits. Some of the bell of the stethoscope. No bruits heard. No bruits heard. Now I'm gonna palpate the. First, I'm gonna palpate the angle of Louis, which is where the manubrium connects to the body of the sternum. And then I'm palpating for impulses on the aortic area, the pulmonic area, which is left sternal border of the angle of Louis, and then the tricuspid, which is the 4th intercostal space, left sternal border, and then the apex, which is the midclavicular 5th intercostal space, which is also where the point maximal impulse is. All right, now I'm going to auscultate your heart sounds. Aortic, pulmonic, tricuspid, mitral. Listen to the diaphragm as well. Normal rate and rhythm. S1, S2 sounds heard. No murmurs or rubs or clicks, or S3, S4 sounds. Now I'm going to have you sit up. We're going to do 2 tests. I'm listening for mitral valve stenosis, and so what I'll have you do is actually, first we'll do the aortic murmurs. So have you lean forward, and we'll listen to the apex. I'm going to have you exhale. Another exhale. Okay, good. Now I'm going to have you lean back and turn to your left, so you can lay and turn onto your left side.
Okay.
My stethoscope. All right. No murmurs heard. No S1, S3, S4 sounds. All right. Now I'm going to look at your peripheral vascular system. So I'm looking at your arms, Arms are symmetrical, size is normal, no swelling noted. Venous prominence in the wrists and the hands. Color is good. Now I'm going to just palpate for any swelling, any edema. Nail beds are pink. Capillary refill less than 3 bilaterally. Just going to feel your epitrochlear nodes, any tenderness here. Do you have any tenderness? No? Okay, good. All right, feel your brachial pulses. +2. +2. Okay, your radial. +2. +2. Okay. Now I'm looking at your legs. Normal hair distribution throughout the legs and the feet and the toes. Color's normal, no cyanosis, no pallor, no swelling in the legs. Legs are symmetrical, size is normal. I'm gonna have you lean back for a moment. So I'm gonna feel the pulses in your groin, just so you know. Okay, femoral pulses, +2. Bilaterally, any tenderness. When I feel this area? No?
No.
These are your inguinal lymph nodes. Alright, you can just stay laying. Alright. I'm feeling for any swelling. I'm going to feel the pulses, your popliteal pulses. +2. +2. And then your posttibial. +2. +2. And then your dorsal pedis. Both +2. Capillary refill in the toes. Less than 3. Legs are warm. I'm going to have you stand up for a moment. Looking for varicose veins presence, none present. Okay, you can sit back down. We're going to do 2 more tests. So I'm going to test first for, it's called the Allen test. So I'm going to put pressure on the arteries of your wrist. I'm going to have you make fists when I tell you.
I'm going to take this off.
You can keep it on. That's fine. Alright, so you can release your hand for now. Alright, now make a fist. And release it. Okay, good. Perfusion returned. Alright, make a fist again. Alright, release it. Okay, good. Perfusion returned. Alright, so negative Allen test in the left arm. Alright, make a fist. Open up. Perfusion returned. Make a fist. Open up. Alright, perfusion returned. Okay, so negative Allen test in both hands. Now I'm going to have you lay back down. I'm just going to lift your legs up until you have some pallor. So I'm looking for arterial insufficiency. Okay. I'm going to have you dangle them. Alright, so color's returning in the ankles. The veins in the feet are starting to swell again, normal response. Alright, and the last thing I'm going to do is I'm just going to test for edema in your legs.
Okay.
So I'm just going to press on the shins. Alright, no edema present. Ankles. No edema, and then press on the feet. No pitting. No edema present. Okay. And that concludes our assessment. Thank you.
Sounds good.